Medical groups are pushing back after President Trump signed an executive order aimed at overhauling U.S. vaccine policy. The president will reduce the number of recommended childhood vaccines from 18 to 11, and his order also calls for breaking up the measles, mumps, and rubella vaccine, or the MMR vaccine as it's commonly called, into separate doses, and requires further study of the ingredients in vaccines like aluminum.
But medical experts are warning that changing what's in vaccines means that you have to do new studies, which are costly and could also take years to complete. And as kids are heading back to school, many parents are left with new questions about how many shots their kids should get and when. We're joined now by infectious disease expert at the University of Maryland, Dr. Wilbur Chen. Dr. Chen, thanks so much for being with us. We want to go through a number of claims made by the president and his advisors. First, here is the president actually praising the polio vaccine and others as amazing, but then also saying there are questions about others. Watch this.
Nothing bad can happen from what we're doing. Nothing bad can happen. It's possible it doesn't work. I don't think that's much of a possibility, frankly. We're going to learn a lot.
Is it possible that something bad can happen from these changes? How much do you expect the administration also to learn?
Well, the routine childhood vaccination schedule has been in existence for many, many years, and we have a long record for safety and effectiveness. So I think that there's always room for improvement, but I do not know if we need to make a large change to decrease the number of vaccines.
And the president also, Dr. Chen, baselessly suggested, which he's done before, that MMR, the vaccine, is unsafe. Let's listen to part of that.
I think I heard you say that the MMR vaccine for measles, mumps, and rubella is quite lethal. Is there any evidence of that?
What I've heard is that there are some people that say it is that way, and I say, well, let's say there's a 5% chance of it. Let's split it up. In fact, they've said how safe it seems to be, but I've heard when you put them together, they can be explosive.
Can you fact check that for us?
Yeah, we've had multiple studies demonstrating that these MMR measles vaccines containing are very safe and effective. In fact, just a couple of weeks ago, the Pediatric Infectious Disease Journal published a study of 2.5 million children showing no increased risks of autism or other safety concerns with the first dose of MMR vaccine.
I want to ask you something about something that Stephen Miller said, a White House aide. He claimed that millions and millions of parents feel pressured into taking their newborn babies to get 6 or 7 shots at once, then being told that having a fever for a few days or not eating for a week or so is totally normal. Here's more from Miller.
Nobody has studied it, nobody's looked at it, nobody's thought about it. The pressure from the pharmaceutical industry and from aspects of the medical industry to pump your kids full of shots days after birth with no understanding of the long-term consequences has been a medical travesty.
Is it fair to say there's no understanding of long-term consequences? How much has this been studied?
Yeah, I think it's unfair to say that we don't have years or decades worth of data that suggests that these vaccines, again, are safe and highly effective. We're seeing right now trends for lower vaccination rates in children's, meanwhile seeing resurgence of measles. The past 2 years, we had the highest rates of hospitalizations and deaths with influenza. So I think that, again, there's plenty of evidence that these vaccines are highly effective and safe.
And Dr. Chen, President Trump hinted at a link between autism and vaccines, which has long been disproven. And there's a lot of science on this, right? It's been studied a lot. Studies show no connection. Secretary Kennedy talked about increased instances of autism in America. He claimed that one of the talking points of the what he called the industry is that autism was just being noticed more, and he called that an absurdity. Here's what he said.
If we were just noticing it more, we would notice it in older groups, but we're not. We're only noticing it in kids who were born around 1989 or after. The older generations, you're not seeing those increases. So something happened in the mid-90s that changed our children.
What do you say to his line of reasoning there?
Yeah, I think that we're just more sensitive to this entity called autism, and we know that it's a spectrum now. It's much better defined. There is, meanwhile, a large body of scientific studies that fail to show any link of autism with vaccination. So there are no studies that have definitively linked autism with any vaccine.
Dr. Wilbur Chen, thanks so much for sharing your expertise. Appreciate your time.
Thank you.